Hello everybody and welcome to the Thursday edition of Video Clips. And I have a couple topics to talk about. And the first one has to do with cognitive function. You know, if you want to maintain strength, coordination, balance, and flexibility as you age, you have to exercise your body. And research shows if you want to maintain cognitive function as you age, you have to exercise your brain. And the more exercise you give your brain, the better off you are. Now, this is a really interesting study I'm going to talk about here today. Researchers looked at data for 534 men and 532 women who were participating in a longitudinal study. The participants were given scores based on the complexity of their occupations and in terms of their jobs and their work with data, people, and things. There was a clear connection between the complexity of their jobs and the work that the subjects did as part of their jobs and their cognitive performance at the age of 70. Even after controlling for factors like IQ at age 11, years of education, and social interaction. Now, the types of jobs that scored well for complexity of work with people included lawyer, social worker, surgeon, and probation officer. The lower scoring ones, as you might imagine, factory worker, painter, carpet layer. The types of jobs that scored well for complexity of work with data were businesses like architect, civil engineer, graphic designer, and musician. Lower scoring, construction workers, telephone operators, and food servers. The occupational effect was small. It was about 1 to 2%, but that is about the same effect for a whole lot of other factors like smoking, social interaction, diet, exercise, etc. And if you take all of these factors together, collectively, they represent a huge amount of determining what your risk for losing cognitive function really is. Now, some things that people can do. If you have a low complexity job, it doesn't mean that you can't keep your brain active. You engage in activities that stimulate the brain, like reading, playing games of skill, taking classes to learn new things, volunteering, other such activities that require thinking. Studies have also shown that even if you're starting to lose a little cognitive function, programs like Lumosity have been clinically proven to improve cognitive function. And by the way, I don't know if you've ever played those games online, but they're really fun. And I bought them as gifts for people. You can do gift certificates for family members and friends too. Okay, Glenn Finney, spokesperson for the American Academy of Neurology, had this to say. He says, "This is one of the first studies to highlight the importance of work as a form of cognitive reserve. And in that way, it's an interesting study." He also said, "It reinforces the idea that people who are living rich, complex intellectual lives are the ones who are usually going to be the best off in old age in terms of avoiding the ravages of Alzheimer's and other dementias." So, we've all heard the old saying, you have to use it or lose it, right? Well, it's true with your body, it's true with your brain. So engage in thinking type activities. This is a good time to pick up a book and read it, sign up for a class. In fact, you could sign up for a class with the Wellness Forum Institute. That will make you think more. All right. Okay, let's talk about psychological issues. Dr. Peter Breggin, renowned psychiatrist, you've heard me talk about him before. He delivered 2 talks at one of our conferences a couple years ago, and he discussed a number of things. He talked about psychiatric drugs being useless and harmful. In 40 years of practice, he's never prescribed them, and he's never institutionalized anybody, and by the way, never had a completed suicide on his watch. He was also very critical of the psychiatric profession, and he actually said on several occasions, and including when he was here, that maybe the solution to this whole issue of what to do with people who have psychological issues is to identify empathic people, give them some basic training in listening and related skills, and then let those people replace psychiatrists and counselors. Kind of a radical thought coming from a psychiatrist, right? Well, a project designed to reach depressed people in countries that don't have well-developed mental health systems is based on that idea. And it's starting to happen in a number of different countries. So I'll tell you a little bit about what's going on. I think it's very encouraging. In 2002, a research study involved providing group therapy to depressed people in villages in Uganda. The therapy was provided by college students and high school graduates who were given 2 weeks of training. The treatment was highly effective. After a period of 16 weeks, only 6.5% of the participants who originally were depressed had major depression. And that's better results than usually achieved in therapy, by the way. The Thinking Healthy program offered similar interventions in rural Pakistan. Female community health workers were given 2 days of training in basic cognitive behavioral therapy. They then began integrating therapy into their regular visits with pregnant women and new mothers. Within 6 months, only 3% of those in the intervention group who had started out depressed remained depressed. Now, the important point here is not just that it's another example of the fact that cognitive therapy works in many different settings, but that it can be delivered with people who have minimal training. Expansion of programs like this would be an excellent idea, not only for underprivileged people in developing countries, but to make therapy available to everybody in countries like here in the United States. Based on the success of these programs, researchers are beginning to use minimally trained peers instead of community health workers. This seems to be based on Bregan's idea that empathic people who care can be very good at helping others. Mental health professionals in India and Pakistan are currently training women who are much like the depressed women they'll help. They receive just a few days of classroom training and a little bit of field training before working with depressed patients. And the researchers note that this is not such a radical idea. The idea of using social networks to address problems has been done before quite successfully. For example, it's helped a lot with childbirth in many developing countries. The designer of the Thinking Healthy program, Atif Rahman, says that his goal is to eventually train people using computers and phones and to train entire families to be therapy-driven. Another organization, Strong Minds, is also working in Uganda. In May, 26 therapy groups started treating 244 women for 16 weeks with only 4 facilitators. The control group was comprised of 36 women. At the end of 12 weeks, 75% of the women were no longer depressed, and at the end of the program, 94% have recovered. 33% of the controls also improved. A second round of sessions is scheduled to begin shortly, and they're going to try it with 12 weeks as the benchmark because a shorter period of time would make the resources more available to more people. It would help to expand the program faster. The promoters recognize, by the way, the role of mental health professionals in diagnosing depression and helping people who have much more complicated issues. But the peer groups are really effective at providing social support and an opportunity for women to talk about their problems. And the results are not only impressive, but they don't cost very much as compared to the lengthy mental health treatment that often involves drugs that we tend to gravitate to here in the United States. It's noted that the peers also provided specific help with things like helping women to get treatment for an illness or financial aid if needed too. This is an idea that should be explored in the United States, but I think it will inevitably face strong opposition from mental health professionals who, like other health occupations, an idea that should be explored in the United States, but inevitably will face strong opposition from mental health professionals who, like other licensed professionals, are kind of fond of hanging on to their turf. But as other occupations are losing their stronghold, this year the state of Michigan repealed its dietetics law. There have been modifications to a number of other licensure laws in other states. So we see that the trend is away from a small group of people controlling occupations and in favor of involving more people to deliver various kinds of health care. And I think that that will probably happen here too. And my thought is that, again, there would be situations, acute situations, in which really well-trained health professionals would be required. But in mild to moderate depression and dealing with everyday life, I think peer-to-peer might have some advantage. So anyway, that's all for today. It's all for the week. And believe it or not, it's all for the year. This is our last broadcast of this year. I take a little bit of well-deserved time off and get worked up and organized for a great new year. I think 2015 is going to be a pretty incredible one. So with this, I'll wish you all a very happy and healthy holiday. Enjoy the time with family and friends. That's what I'm planning to do. And I'll be back to you the week of January 5th.